Morning, everyone. A very warm welcome for joining us today at NCC Public Webinar on Managing Your Risk of Female Cancer. I'm Amelia, the facilitator for today. Before we begin, there are a few pointers for your kind attention. All attendees mic will be muted by default. You may post your question using Q&A function found at the bottom of your screen here. Please ask topic-related questions only. Thank you. Today, we are very privileged to have Professor Tayson to speak with us on managing your risk of female cancers. Professor Tayson is a senior consultant obstetrician and gynecologist in the Department of Obstetric and Gynecology, Singapore General Hospital, and National Cancer Centre, Singapore. Prof. Tay pursued his undergrad and postgrad medical education at University College London, UK. He is a fellow of Royal College of Obstetricians and Gynecologists, London, and holds position of clinical professor in Duke NUS Graduate School of Medicine and Yong Loo Lin School of Medicine, National University of Singapore. Prof. Tay has been conferred several prestigious awards, including Hamilton Bailey Prize in Surgery in London, National Science Award for Outstanding Contribution in Research of Gene Immunotherapy in Gynecological Cancers, and Benjamin Shear Memorial Lectureship and Gold Medal of the Society of Obstetric and Gynecology, Singapore. Prof. Tay is a keen researcher and has published more than 110 papers in national and local scientific journals. He has authored a book titled Cervical Cancer, Its Causes and Prevention for General Public Reading, and a medical textbook, Gynecology Clinical Illustrated for Medical Education. Ladies and gentlemen, please welcome Prof. Tay. Prof. Tay, please.
Good morning, ladies and gentlemen. Thank you very much for taking your time this morning to join us in this discussion on managing female cancer's risks. So what I would like to do, hopefully within this hour or so, share with you some of the knowledges about the female gynecological cancers and the risk factors for the cancer to happen, as well as, more importantly, talking about some strategies and means that you have to reduce these risks so as to manage the probability of being affected by one of these diseases. So I would also have time at the end of this presentation to share some of the questions that you might have so that we can actually discuss your issues more thoroughly than what I have presented on this morning's slide shows here. Right, let me just get started by sharing with you again these talks this morning. And as you notice on the title of this symposium or this webinar, there are three key words that I want to highlight to you. First of all is about this management, and then about the women's cancers and the risks. So the women's cancer is the subject of our discussion. We are not going to talk about other subjects such as lung cancers or colorectal cancers. We are going to focus this morning on women's cancers. And we are going to talk about risk factors. So what we would like to make sure that all of you are aware of some of these risk factors. But most importantly, that's why management comes to the front of this title, which is actually the management, and to show you some of the means as well as strategy for us in managing the risk that you are now going to be aware of. When we talk about the strategy being important in the management, then we, as usual, would look at our predecessors, those learned people's previous publication on different strategies. And if you look at cancer being such an important disease that is threatening to the patient, obviously it is as if you are on a battle. You are in a war as such. So I would like to share with you some of the strategies used in the wartime from this very ancient but very well regarded textbook of the art of war. And this is 2,500 years ago, the wisdom. And it has been so highly regarded because not just that the person, the author, was a military general, but he was more highly regarded as being the best strategist and also philosopher. So I think things over the 2,500 years, such a person being so well regarded, both within the Chinese community as well as internationally, whatever he has to offer may mean something to us. Most of us are aware of the saying, know thyself, know thy enemy, 1,000 battles, 1,000 victories. And that is a very well and widely quoted from the art of war. So let's come back to the subject of women's cancer. This chart shows you the causes of mortality in Singapore in the year 2017. So all the mortalities, all those people who died during that year and their causes of death was summarized in this pie chart. I just want to highlight to you that cancer is a very important cause of death, responsible for 1 out of 7 mortality. So it really is a very important thing. But when we look at all the cancer mortality, you actually see 1 in 7 cancers in women actually occurs in what is known as reproductive organs, as shown on this chart below here. This is a pictorial chart of the reproductive systems involving the uterus in the center and the fallopian tubes and ovaries at the side, and the uterus joined at the lower end to the vagina. The lowest part of the uterus where it joins to the vagina is known as the cervix, which is an important organ for cancer development. If you look at this chart, look at the top 5 most common cancers in women in Singapore, you would see, yes, breast cancer is the most common cancer, but you also see that uterus cancer and the ovarian cancer are among the top 5. If you extend the top 5 to top 10, then the cervical cancer is also one of them. So that's why we say 1 in 7 of the female cancer is from the reproductive systems. Good. Now that we know what females cancers are, the most common cancers being the uterine cancer, the ovarian cancer, and cervical cancer. In Singapore, the cancer registry was in action since 1968. All cases of cancer diagnosed in Singapore were charted. So you can see over the last half a century, and look at the top chart, the uterine cancer, you can easily see the very rapid rise of the incidence of endometrial cancers over the last 50 years, particularly in the last 3 decades or so. And this is rocketing without any sign to say it was plateauing, slowing down, or coming down. So over the last half a century, there has been an increase of 350% in the incidence of uterine cancer. So this has become, over the last 15, 20 years, the most common cancers in women's reproductive cancers. The second chart in the middle shows you the same incidence trend for ovarian cancer. Yes, it is still rising, but the rate of the rise is not as remarkable as endometrial cancer. So over the last half a century, the rate has almost just about to be doubled. Cervical cancer, on the other hand, has a more successful story to tell because in the last 40 years or so, there has been a slow decline in the incidence. But you can see in the last 15 years or so, the slow down of this decline is very remarkable. We would say more or less it is actually plateauing. We are not seeing further reduction. There must be some reason for that, and hopefully later on I will be able to show you why. So let's turn back to the book. The book says that yes, all these cancers that I've just shown you, the statistics. So should we ignore them? Obviously not. A lot of the patients, when they come to see me and was diagnosed to have a cancer of the uterus or the ovaries or the cervix, the first response was always, how can it be? I never thought it would happen to me. That is the usual response. The second response was some anger. Why should it be me? Why not everyone else, but why should it be me? So, that is a very common response. But the art of the war tell me that do not rely on the likelihood that the enemy not coming. You cannot assume that they are not going to come and invade you. What you should do is to gear yourself up, get yourself ready in case the enemy turns up at your doorstep. So this is a very important and very practical advice that all of us, when we come to health issues, not just cancer alone, we have to get ready to face the possibility of the disease coming. So therefore, the first thing people will want to know, how do I know cancer happens? And all of us know, all of you know, the problem with cancer is it is so silent. And that is generally absolutely true when the cancer happens in the early stages. It doesn't show any sign. It was until later on when it becomes to cause some complications, then it shows. Having said this, you don't have to be too disappointed. More importantly is to be aware that there is or there are some signs that you should not ignore. You should not ignore any of the signs I'm going to tell you in the next few seconds. Because most of these signs are not necessarily cancers. In fact, most women showing these signs never have a cancer. But if it is going to be a cancer, the cancer will share some of these signs. So any of these signs that turn up, don't panic. Don't assume that you have a cancer and just give up. You should consult your doctor and let your doctor to do a proper diagnosis to see what the signs and symptoms means. So what are these signs? Well, the first thing is what we call abnormal vaginal bleeding. During the between 12 and 50 years old, women have monthly regular menstruation. Of course, every woman are aware of that, and they would never thought of anything wrong with that. But when it is outside that monthly regular period, then it becomes abnormal vaginal bleeding. It could be bleeding after menopause. It could be erratic periods that no longer come in a fixed regular cycle, like every 4 weeks or every 5 weeks. Of course, the exact duration of whether it was every 25 days, 28 days would be depending on individual woman. But to herself, she would always see the same pattern. When that pattern is lost, the period comes for 5 days, stop for another week, and then started again. That is erratic. It doesn't have the cycle anymore. Or the period lasts for longer. Most women have menstruations or periods for between 5 to 7 days. But if a period goes on and on, after 1 week, there's still no sign of rebating. After 10 days, it's still going on. After 2 weeks, still not showing any signs of stopping. That is what we call a prolonged period. Or some bleeding after sexual intercourse. Sexual intercourse is painless and is usually not associated with any bleeding. When that happened, you wanted to know, is this a sign signifying something going on? Don't panic, but you should see your doctor. Well, bleeding is easy to see, and most people are unlikely to ignore it for too long because people usually cannot tolerate the bleeding for too long. But there is another important sign, that is vaginal discharge. Of course, there is always some secretion from the vagina, which is normal. It keeps the vagina moist and keep the vagina healthy. But when the secretion becomes excessive, there are women who need to put a pad on because of this, discharge. And particularly this excessive discharge goes on and on and on and on. Then it becomes a prolonged excessive vaginal discharge. And it is important. I just been seeing a patient who has this symptom and has been bothered by it for many months, but couldn't actually be bothered to get it seen to until finally when she comes on and she was diagnosed to have advanced cervical cancer. So prolonged excessive vaginal discharge is important. There are also very vague, non-specific symptoms such as abdominal bloating or swelling, abdominal pain, or unintentionally you are losing weight. These are, I say they are very vague because most of us would have, from time to time, some kind of abdominal pain. But most of the time, we understand why the pain is there. It might be because you have not been attending to the toilet for a couple of days, or it might be that certain food that has been upsetting to you. You know it. And also, after you have done what you are supposed to do, the pain goes away, or the bloating goes away. Those are, of course, not important. What I refer to here, abdominal bloating or pain, I'm referring to those that you don't have an explanation yourself. And also the symptoms don't just go away after waiting for a day or even two. It just go on and off maybe, but prolonged for many weeks or even a month or two. So these are symptoms you must not forget. Why is this early recognition of cancer important? Because it's always easy to do any treatment before the condition becomes too difficult. All right. So we like to do things when it is easy. And also, don't forget, sometimes you do something small today, you actually achieve something that's great later on. So don't belittle an action being such a small thing, such as attending to your, the family doctors just around the corner of where you live. It is important to do all these actions. So how can we prevent cancer? We said earlier, you can have 1,000 battles and 1,000 victories, but our great strategies and philosophers tell us the best winning, the greatest victory is that which requires no battle. When you started to tell the enemy, I'm going to invade you, I'm going to fight you, and the enemy just surrender. Say, oh, no, I'm not going to fight with you. So that is the greatest victory. Can this be applicable in gynecological cancer? Well, if we understand the risk factor for gynecological cancers, maybe we can remove them, change them, mitigate them such that a battle will not happen or a cancer will not arrive. So I divide the risk factors for gynecological cancer into 4 groups. Those related to lifestyle, those related to metabolism, those related to viral infection, and some because of the genetic background. So these are the 4 big groups of risk factors for gynecological cancers. Let's go and see some examples. Let's look at uterine cancer. As I told you, the most common gynecological cancer. And if we look at it, the risk of this cancer increased by 30% if a woman is overweight. And again, it increases by 200 to 300% if this woman has never given birth before. If the woman actually takes a postmenopausal estrogen treatment alone, she also has a very high risk. or if she takes tamoxifen after surgery or chemotherapy for breast cancer, there is also very significant rise. There are also diseases which increase the risk of endometrial cancer or uterine cancer. There is a condition of the ovary known as polycystic ovarian disease. And also very common disease in our community, just simply high blood pressure, diabetes mellitus, and also in a small group of women who have some existing uterine abnormalities. So these are diseases which can all be managed or be treated, and you need to do something about controlling these diseases. What about ovarian cancer? The most deadly cancer. And ovarian cancer, the characteristic of women who have this cancer, they show no history of pregnancy, never been pregnant. If a woman has delivered a child, her lifetime risk actually is only 50% of those women who have never been pregnant. Or if a woman who has been on what is known as combined birth control pills, also there's a great reduction in the cancer. But there are also some genetic factors. If you look at the lifetime risk for developing ovarian cancer in a woman who has no family history, her lifetime risk is extremely low at 1.6%. If one of the family members, say a sister, has the ovarian cancer, then suddenly there's a 3 to 4 times increase in her risk of ovarian cancer. And this would multiply if there are more members in the family affected, or if she in fact has been tested to carry an abnormal breast cancer gene, we call BRCA1, and there's a great increase. In fact, her lifetime risk is almost 45% chance that she will develop. Or the second type of the breast cancer gene known as BRCA2, there is a 20% chance of developing ovarian cancer. So ovarian cancer has, in some cases, a genetic background. So I want to come briefly to this concept of inheritable cancers, because many patients ask me about whether they have inherited a gene that makes them more easy to develop gynecological cancer. Overall, among all cancers in human, only about 10% are caused directly by an inherited genes. 90% just happen by chance. So the way the genes are inherited, there are two types. One is what we call single gene inheritance, meaning that there is one gene, just one gene alone. If that one is present in this person has a much higher risk of developing that cancer. And how do we know whether a person has a single gene in her? Usually we look at the family background. There would be multiple members affected by these small little group of cancers, because every single gene is responsible, not one single cancer, but a small group. But it would not be all cancers in human. There are more than 300 cancers in human beings, but say a breast cancer gene. Breast cancer gene is responsible for just a handful of cancers, such as breast cancers, ovarian cancers in the family, or pancreatic cancer, or the male partners have prostatic cancers. So these few cancers, they are so closely linked to this particular gene. So we look at the pattern of the cancers among the different members in the family would have some influence whether these family have one single gene inheritance. The other group is multiple gene inheritance, meaning that several genes are needed for a cancer to develop. So what actually shows in this type of inheritance is that you see several members in the families or generations have cancers. Some people, and a lot of patients tells me, that, oh yeah, I come from a family very prone to have cancers. My so-and-so has this cancer, my so-and-so has the other cancers. But when I listen to her, wow, I know all these different cancers are unrelated to single genes, but they may have multiple gene inheritance so that they get a multiple types of cancers. So let's have a little bit of understanding what role does inherited genes do. First of all, let's understand what a gene is. A normal gene is a long string of codes, different genetic codes consists of DNA units. You look at this chart here. These different colors are just different codes of DNAs, and a particular gene have a very specific types of the codes in the DNA arranged in a very specific way, and that is what a gene is, just a chain of DNA. And this gene, and we have thousands, hundreds of thousands of genes in our cells. When a cell is reproduced, when we develop a new cells, all these genes are copied, they are duplicated so that they can pass a same set of gene to the next new cell. As you know, when you have so many things to copy, not surprisingly, sometimes you copy wrongly. So for example, one DNA may be missing, or one DNA may be substituted by another letter. Or, although all the letters were correct, but they were rearranged in such a way that the order is wrong. So all these are known as mutation. And once a mutation occurs in the gene, that new version of the gene is known as a variant of that gene. So we can have variant. You're familiar now with the COVID-19. We have a different variants. We have the Delta, we have the Beta, we have the Mu. We have many variants, all because of the changes in their DNA. So in our cells, not the virus, we also have this kind of phenomenon of variance genes. So what do genes do? Genes are basically a blueprint for the proteins, the cell functions, the things that control all our cell functions and all the characteristics that each one of us shows, like my hair, being straight or being curly, or whether I'm going to lose hair by a certain age, or whether my eyes is going to be rounder or less rounded. All these characteristics that distinguish one individual from another are all determined by protein function within the cells. And how do you make all these proteins? You need a blueprint, just like your contractor who come to do the renovation for your house. They need to have a set of drawing from the architect or designer so that they can make exactly the products that you want. So that is exactly what gene does. And in our genes, protein functions, when we come to cancer, they are a group of very important proteins who have very important function. Like for example, occasionally our DNA is broken and there is a protein that actually repair the damage for us. Or there are proteins that would stop cancer cells from growing. Equally, there are proteins that actually like adding fuel to the fire and make the cells to grow even more rapidly. So all these are different types of proteins coded by different genes. So when you have a variant gene, when the version becomes abnormal, why is it important? Indeed, in many situations, it's not important because that variation happened to be unaffecting the protein. So the genes, the protein still function as original genes. So this kind of variation becomes non-pathological, not causing disease. But there are variants that resulted in new protein, which has no more functions. Like for example, the gene repair protein is no longer functioning. It can no longer repair a broken gene. Or there are proteins that actually make the cells grow faster. So this kind of variants, these new versions that will result in diseases, and they are known as pathologic variants. So it is important for me to stress that gene variations or mutations is very, very common in our body. Luckily, a lot of the time it doesn't matter. So what matters is only if it resulted in disease. And come to the cancer. Look at the cancer development. If a person has normal set of the genes, she doesn't have any abnormal variants. For her to develop cancer, there are many different events happen over out to be a cancer. But if you look at a person who has a pathological variance, and it actually cuts short one or even just a couple of steps of changes will result in a cancer. So immediately you can tell that for this person with normal gene sort of makeup, it is not easy for her to get cancer. But for this other person with pathologic gene, it is indeed very easy for her to develop cancer. We look at the example of the carrier of breast cancer gene 1 and her lifetime developing breast cancer. If she doesn't have these variant, pathology variant, then her chance is only 15%. If she is carrying a pathologic variant of this version of the gene, her lifetime chance is 85%. So this is just an illustration. An important thing is for you to understand that all the so-called cancer genes, they are not made to be cancer genes. The nature doesn't make us to have a cancer gene to develop cancer. It is normal gene we need for our normal function that has become defective. Some damage happened to them, and then it lost the proper function. As a result, it increased the risk of cancer. So hopefully you are clear in the concept that no cancer gene exists, but normal cells can have a variation due to the mutation to become predisposing you to cancer. So how do we know? How are these genes inherited? How does it inherit? How does it pass on from one generation to the next? We consider this, say, a parent. A parent, all the cells I illustrate here, just one gene. Genes always comes in pairs, and this particular person has a pair of these genes, say for example, BRCA cancer genes, and one gene is normal, but one other unit is abnormal in rate. When she produces X, for example, if this happened to be a girl, she produces X. All these genes are copied, as I say. So she'll produce two types of X. One type that has only the abnormal gene, and the other groups of X have all the normal genes. Likewise, in man, if this man has no such abnormal genes, both units in the pair are normal, then all the sperms are going to be the same type, carrying the normal gene. And when they are married and they are going to have a offspring, have children, the children is going to have the eggs from mother and the sperm from the father to combine. And if by chance a normal egg is chosen and the sperm is, as I say, always normal, then she would end up to be like the father, absolutely normal. So although the mother carries the BRCA gene pathologic variant, she doesn't inherit it. Likewise, if the sibling happen to be conceived on this abnormal gene in the egg and the sperm, which is always normal, then she would end up like the mother. She will be a carrier. So that's how an abnormal gene is passed on to the next generation. You would immediately realize not all the offsprings will inherit the gene. And if we look at the number of parents affected by this abnormal gene, if only one of the two were affected, then the chance that the offspring, the children, inherit this abnormal gene is 50%. Unfortunately, if both parents carry the same abnormal variant, then the chances of the children to inherit one or even two abnormal genes is 75%. So it is important to understand that a family may have an inheritable gene for cancer, but not all the children will get it. I just want you to be clear. So who should go for cancer gene testing? Should I go for the cancer testing? By what I just said, you probably can anticipate what I'm going to say. If a girl has a breast or ovarian cancer patient, is a breast or ovarian cancer patient, we would ask, does any of your siblings have it? Either your own directly or your cousins. If one or more of them are also sharing one of these cancers, then we say, yes, you should come and see our specialist called genetic counseling. This is a special service done by specifically trained doctors and scientists to look into your chances of having inherited the abnormal genes. And they will tell you also which gene to test. As I told you that there are more than hundreds of thousands of genes, which gene we should be testing. They will look at the type of cancers and come to a conclusion. And they will also share with you, for you, what are the benefits of doing the test and what are the risks of doing the test. So this is very important so that you can make a decision whether you want to do the test or not. And of course, also very important, as you have already understood from what I say, if we detected a mutation in your gene, what does it mean? Is it a mutation that doesn't bother you, or is it a mutation, a variant that we will call pathologic variant? So the geneticists will actually analyze and tell you exactly what your test means. So that is what would happen. But if, like in Singapore, many people do not have siblings, they are the single child, then you wouldn't have this information. Then we look at the parents. Any of the parents have this group of cancers? If yes, then yes, you also should go for the genetic counseling to consider for gene test. If no, the immediate parents don't have, we go on one generation more and look at the grandparents. If the grandparents have these, then again, we say you should go for it. So this is a very positive family history for the cancer. What about you and I, an ordinary person of strict, who has no personal or family history of inherited cancers? Should we go for genetic counseling? There are tons of services available now on internet to do the gene analysis for you, gene testing for you. Should we just buy it over the internet and do it? Our current understanding from what I have just discussed with you about the risk and benefit of the gene testing, and also to be able to understand what the test result means, we would say to you, please don't go for the gene testing. You don't need it and you won't benefit from it, and you probably would be very confused by the test. So there will be more risk than benefit for this particular person. Now, so much so on the genes that, on the cancer, I want to turn on to this most preventable cancer, the cervical cancer. You can see this huge lump sitting on the cervix. And this is one of the cancer we know very, very well, that it is caused by human papillomavirus infection. Most of the time, we don't know precisely what is the cause of a cancer. But for the cervical cancer, we are very sure it is caused by these. But there are some women who are at higher risk of developing HPV infection, the virus, or their HPV are more likely to go on to become cancer. And the risk factors include those girls who started to engage in sexual life from the teenaging group, or they over the lifetime have many sexual partners in order to search for the most suitable one for them, and that also increase their risk. Or they are cigarette smokers, or they are on immunosuppression, including HIV infection. we will look at the way that cancer develops. If you look at this, which is a tissue section of a normal cervix, if it happens to be infected by HPV, then there would be a series of changes related to the HPV infection, which if the HPV infection does not recover naturally, it can go on and develop more severe abnormalities known as a precancer. Once precancer develops, particularly the severe form of the precancer, we call it CIN3, then there is indeed a very serious risk that the cancer can develop. So that's why we know HPV is critically important in this. So how do we reduce our risk of cancer? Well, what does our guru tell us? It says the opportunity to secure ourselves against defeat lies in our own hands. You are the one who determines whether you are going to win or not. And the important thing is, for those people who win the battle, they actually plan effectively and they do changes decisively. That's what I mean by in your own hand. You have to plan and use something effective, and you have to do it very decisively. You cannot say, oh, I'll do it the next week. And then when next week comes, you say, well, when I am freer or when the husband can go with me. That is not decisively, all right? Effectively means that proven methods that are useful. There are many methods advocated by many different sources as being useful for preventing cancer, like use of mega doses of vitamins, antioxidants. All these are ineffective. They are not, if you think you can reduce cancer by taking those supplements, you are not planning effectively. That's why at the end of the day, whatever you decide in your own hands would actually result in whether you can reduce your cancer risk or not. So to mitigate your risk factors, for example, lifestyle, you could easily reduce your weight to the optimal weight. You can work with your doctors to make sure that your medical conditions, be it diabetes or hypertension or polycystic ovarian disease, well controlled. Or if you are taking medications like the tamoxifen for the breast cancer, work closely with your doctors to see how you can make use of the medications wisely. If you're a cigarette smoker, you should obviously stop it. When you come to prevention, you know, as I told you once before, the greatest victory is that which requires no battle. And we know HPV infection being the cause of cervical cancer. You don't have to deal with the cancer. If you can tackle HPV infection, you don't need battle. And this is, where HPV comes in the process of the cervical cancer development. So we do have very effective HPV vaccines. There are 3 available in Singapore. All right. And if you are less than 15 years old, or if you have daughters or granddaughters of less than 15 years old, they only need 2 doses done 6 months apart. You may ask, why should such a young girl go for a vaccine for something that is not good? She's not going to develop a cancer. I just want to show you this information. Look at this red chart. The peak of the HPV infection occurs at 20 to 24 years old. In Singapore, this peak is 25%. 1 in 4 young women at between 20 and 24 years old have been tested positive with HPV. So for us to effectively prevent HPV infection, the precaution has to be taken well before this. So that's why it's less than 15 years old. Now in Singapore, schoolgirls receive this vaccination, or they are asked to participate in vaccination programs at Sec 1 and Sec 2, which is 13 and 14 years old. For the young women beyond 15 up to 26 years old, they are in this group. They are still benefited from the vaccination, but they need 3 doses instead of 2. And we still strongly recommend that they do. So vaccination has been shown to be extremely effective. You look at these 2 columns. These are the diseases, the pre-cancers that that develop among women not vaccinated compared to this other on the right-hand column, who are vaccinated. You see the reduction is 93%. It's extremely sort of protective. So how do we reduce the risk if we miss the chance of having the vaccination at the 26 years old and earlier? You know, the guru say, plan for what is difficult while it is still easy. Do what is great when it is small, and you can reduce the risk. Like, for example, if you being a BRCA gene carrier or one of the other gene carrier, that geneticist told you that your risk of developing ovarian cancer is very high, you could actually go for a simple keyhole surgery and remove the ovaries. So you should talk to one of us, the gynecologists, who will tell you the pros and cons, the benefits and risks, and when to do this surgery. Of course, we don't do it for young women, but we do it for many other women who would find this suitable. By taking out the ovaries, there will be no more ovarian cancer. So although you are born with the BRCA genes that gives you this predetermined risk for the ovarian cancer, we can actually prevent it from happening totally. Or when you come to cervical cancer, if you lost the chance of having HPV vaccination because it didn't come in your era, we still have this, what we call the pre-cancer, which is a lot simpler to treat than the cancer. The pre-cancer, however, is very silent. We say the cancer is silent. Pre-cancer is even more silent. It's totally silent. So we luckily have an effective screening test. You go to the clinic, the doctor would actually obtain a sample for you and do what we call Pap smear, which is now recommended for women between 25 to 29 years old. For the older women, we actually do the HPV testing. If you are tested negative, since HPV is an absolute a necessity for cancer of the cervix to develop, if we tested that, oh no, you don't have the HPV, you can sleep in peace for the next 5 years. So it's done every 5 years. It's even more effective. That's why in Singapore, we are using HPV testing. So once you have an abnormal screening test, either the Pap smear or HPV test, we actually go and make a diagnosis whether you have a pre-cancer or not by doing what is known as colposcopy. Using the microscope, we can enlarge the cervix and see, yeah, this area is the abnormal pre-cancer, and we have effective treatment. Like, for example, within 10 minutes, this abnormal cervix, this abnormal pre-cancer is removed. And within 2 to 3 weeks, the cervix is healed, perfectly normal and functioning normal. So how do we reduce the gynecological cancer overall? The opportunity to secure ourselves against defeat is in your own hand, but you must be effective, plan effectively, and change decisively. Look at the 3 cancers. Uterine cancer, unfortunately, there's no effective screening. So you have to modify risk factor through lifestyle, through metabolic conditions being arranged, medications. If you come to cancer, ovarian cancer, again, there's been no effective screening that I can recommend to you. So you look at your background risk, genetic risk, the use of the oral contraceptive pills being protective, or indeed, maybe you would decide not to postpone childbearing. But we come to cervical cancer, yes, cervical cancer is highly effective, right? Highly effective in the screening. We have the Pap smear, we have the HPV test, and we need to go and do it. Having said that, being highly effective, why are we seeing the decline only by 50%? Why are we actually not seeing further decline in the last 15 years? Can I still call the Pap smear or the HPV testing being highly effective? Let me show you our statistics. Look at the MOH, Ministry of Health survey. Over the last, the 2 or 3 decades, you see women in public awareness, understanding the Pap smear is rising. It reaches more than 95, almost 95% of women say, I know what it is. I've heard of it and I know what it is for. But you look at the green chart, women who actually have been doing the pap smear according to recommendation is actually just around 45%. So knowing it is one thing, actually doing it is another thing. There is a big gap between good awareness and the poor action taken. That's why I emphasize so much the strategy offered by the art of war, that if you want to win, the power is within your hands, and you must choose effective method and do it decisively. And you can see that for cervical cancer screening in Singapore, this is not happening, unfortunately. That's why our result has not been as good as some other countries. For example, in Australia, they have done much better than we have. So we still have a lot of gap to improve on. Now, I want to summarize what I've just said over the last 3/4 of the hour. You now understand what I mean by gynecological, or what is known as women's cancers. Okay, there are cancers arising from reproductive systems, endometrial cancers, we have the ovarian cancers, and we have cervical cancers. These are the most common. Just these 3 cancers alone, they are responsible for 95% of all the gynecological cancer. That's why we are not talking about rare cancers of the reproductive systems. You know the risk factors for these cancers, lifestyle factors. You know about metabolic abnormalities. You know about genetic background and when to use the genetic informations. And most importantly is that you have to decide whether you want to change. And change to what? You must change to take effective precaution. So with this information, I really think that you should be more confident now and no longer so anxious about these cancers. And you probably would be able to use some of these strategies to manage the risk that you might have for the gynecological cancer. Well, as they say, die yourself, die your enemies, 1,000 battles, 1,000 victories. Thank you for your participation to this presentation. Thank you.
Thank you, Prof. Tay. Now we have come to the Q&A section. Let me read out some questions posted. So for the first question, irregular menses and in between has staining. Is there any signs of concern?
Well, it is a concern that if it is persistent, okay, if it doesn't actually stop after when it first appears, it has been repeatedly, then it is a concern to have doctor to actually have a look and analyze it for you.
Okay, another question will be, is genetic test costly?
Well, yes, it depends on which types of genetic tests. So we have a different range depending on how we decide the risk of the genetic test is. So if the family history is so strongly suggesting the breast cancer gene being involved, then you only need to do a very small group of gene tests, a very small panel, and that is not very expensive at all. It's very affordable. But for others, when the genes involved is not so clear-cut, then we may actually resort to a much wider net and do all or most of the genes. We can easily nowadays do genetic profiling of all your hundreds of thousands of genes, but of course it will cost more money. So that's why genetic counselors and genetic counseling is critically important. He or she is the one who's going to look into the details for you and come up with the appropriate test for you. and to be cost effective.
Thank you, Prof. Tay. Our next question is, when a person is age 72 years old and above, right, is there a need to continue with pap smear yearly? Can you advise, please?
Good question. As I said, that the HPV is the cause of cervical cancer, and most of the HPV were caught during early in their lifetime, early. So the risk of cervical cancer actually is planted when they are very early. So between, say, 25 years old and 70 years old, if the person has been undergoing regular testing and found to be negative, meaning normal, all these years, then we could be very confident that she has not actually developed HPV or catch HPV infection ever in her lifetime. Then she doesn't actually need to be screened. That's why I said, for the HPV testing, the recommendation is between 30 years old and 69. We actually stop at 69. On the other hand, if this 72-year-old come to see me and I found out that, oh, she actually has no regular screening. She only has done it, 1 or 2 times when she after given birth, and since then she has never participated in any screening. Then I would say yes. Even at 72, you should do 1 test. And if this test shows to be negative for HPV, then you don't need to do it anymore.
Okay, thanks, Prof. Tay. And there's one participant who's concerned about how about those who doesn't have menopause anymore?
No menopause anymore. It means every woman has a menopause. It's a question of at what age. So menopause, just to clarify, the menopause means that there is no more menstruations and around the age of 50. Some confusion is when people talk about menopause, they are referring to menopausal symptoms. When a woman goes into menopause and say between 49 and 50 years old, she's still menstruating, but she experiences hot flashes, sweating, mood changes, sleep disorders, and these are the symptoms that shows that her hormones are changing. And so I have come across quite a number of women who misunderstood these symptoms as menopause. So when they say, oh, yeah, I did have those feelings about a year ago, but now I don't have it anymore. Then the mistake was that I've passed the menopause. I'm no longer menopause. This is not true. All right. What you actually are saying is that you are no longer getting any symptoms from the hormonal change. The menopause is just a phenomenon to say that you would not get periods anymore. You would have no more chance of getting pregnant anymore. All right. So unrelated to the symptoms. So if I take it that the questioner asked that she is no longer experiencing the menopausal symptoms, and say now for the last 3 or 5 years, there's been no more hot flashes, does she still need screening? The short answer is yes, so long as she has not undergone any surgery that removed the cervix. Like some people, because of menstruation disorders, the doctor has taken the uterus out in what is known as hysterectomy. Those women who have no more cervix obviously do not need cervical screening anymore. And that is, to sidetrack a little, is the reason why we are recommending risk reductive surgery for ovaries in those women who carries the BRCA gene. If you don't have the ovaries, you will not get ovarian cancer. So long as you still have the cervix, you still should carry on screening until the age of 69.
Thank you, Prof. Tay. The next question, can you share further why uterine and ovarian cancers risk are higher for those who have not been pregnant or delivered babies? Yeah. And how does one reduce the risk of these cancers?
Right. When we look at the causes of cancer, like I told you very categorically, cervical cancer is caused by HPV infection. No HPV infection, no cancer. When you come to ovary cancer, there isn't such a clear-cut cause, what caused ovarian cancer. But through years and years of observation, we found that women who have never been pregnant before are more likely to develop ovarian cancer. So the theories is that, every month, the nature is to prepare a woman from getting pregnant. So you are producing an egg every month from the age of 12 years old if your period starts from 12. So if you calculate from 12 years old to 50 years old, 38 years, each year 12 months that you would produce the eggs, then you would more or less have just under 500 eggs produced. The eggs are developed within the ovaries. When the egg is ready to be released for fertility, the ovary actually has a small puncture. The small puncture on the surface of the ovaries allow the eggs to escape from the ovary to enter into the fallopian tubes to be carried to the uterus for fertility. So this woman who has never been pregnant would have 500 punctures on her ovaries in her lifetime, 500. And every time there is a puncture on the ovary, it's like there is an injury, there's a trauma, a cut on the ovary, and the nature needs to heal it. In the healing process, you need to produce new cells. Now, that's why I talk about the genes. Every time you produce new cells, what happened to the genes? You need to duplicate the genes. You need to copy the genes. So you are more likely, by keep repeating, keep copying the genes, that at some of the times, some of the genes will turn abnormal, right? So the more ovulation a woman has, the more chances of her gene in the ovaries becoming abnormal. And as I told you that although she has no inherited cancer genes, but because of these one abnormalities in 1 year, and then some years later, second abnormalities, and then yet third and fourth and fifth, eventually it leads to cancer. So the more ovulation a woman has, the more chances of cancer. If a woman has one baby, what happened? During the pregnancy of 9 months, there will be no ovulation. So there will be no egg release. And if she breastfeeds for the next year, again, she will not have this event happening on the ovary. So for every one childbirth, there are 2 years that her ovaries will be resting. So if she has 2 or 3 children, then you can see that her chances of having abnormal genes in the ovary is a lot less. That's why women with no pregnancies are at higher risk. Of course, nowadays, we could actually stop these so-called egg development and release of eggs from the ovaries. And that has also been proven. In those women who decided that, no, I'm not going to bring up a family. I have so other many priorities in my life. It's not my objective to have a sort of children in my family. Then what they do is they go and take the birth control pills. The way birth control pills work is to stop. How does it stop pregnancy? It stops the eggs from developing. It suppresses the ovary from being active. That's why women who take birth control pills also have equal protection as the pregnancy in ovarian cancer risks. So I think if a woman, for some reasons, she needs to take some birth controls, then she should always keep in mind that she should consider the birth control pills for at least a while, not the whole lifetime, of course, but we see that if a woman takes the birth control pills for a year or more, she already would benefit from some protection for ovarian cancer.
Thank you, Prof. Our next question is, how about women who are not married? Should she go for HPV screening?
Right, that is an easy answer for the questions. If this woman has never been married nowadays, of course, marriage or not, it's not important. If this woman has never had a sexual intercourse, then she doesn't need screening. because the virus can be easily caught, yes, on the skin because it's a skin virus. But for the skin virus to be able to infect the cervix, which is after all still an internal organ, is separated from the skin by vagina, which is 10 centimeters. So the skin, HPV infection would not go on and infect the cervix until this girl started to have sexual intercourse. And that is very important. I want to point it out. Although multiple sexual partner increases a woman's risk of HPV infection and cervical cancer, but not to say that a woman who is in a very strict one-to-one relationship would not get it, because she still can catch the HPV infection from other sources by sitting on it, and the virus is staying on the outside skin. But during her one-to-one relationship, the virus is actually delivered from the skin to the cervix. So the short answer is, if the woman has never had a sexual intercourse, she doesn't need the screening. But the reverse is true. Even if she has attempted once before, she's already considered exposed to the possibility of HPV infection, and she should have the screening.
Thank you, Prof. Tay. The next question. After 69 years of age, no PEP or HPV testing, is there considered to be no further risk?
Good question. Why do we stop at 69? It's really based on risk estimation. As I say, if a woman has from 25 to 69 years old, do regular screening like pap smear in the past, which was every 3 years, so she probably would have done 15 pap smears. So the risk of having some precancer on her is very low. So you can say, oh, for cost effectiveness, you can stop. But now women live to 100 easily. Thousands of women live to 90 plus. So from 69 to 90 plus, they are 30 years. Am I saying that there's no chance for cancer to develop? Absolutely not true. Cancer is related to age. So as one gets older, the chances of getting cancer is also higher. So from 69 onwards, the national screening program say you don't need to do it anymore. But for those women who want to take the actions in their own hands, they say, yeah, you told me the risk is low, but I want to have as low as possible, if possible, zero risk. I still want to be screened. We will never say no. Yes, you can, because after all, the message I'm selling is that you take everything in your own hands. So although you go to the polyclinic, they will tell you, no, you don't need to screen anymore, but you say, but I do want to have one done. You still can get one done, and you should.
Thank you, Prof. Tay. Someone is concerned with itchiness and whitish discharge, and what does it mean?
Right. So whitish discharge means that there's some increase in the vaginal secretion, but because of the associated itch with it, it means that it's a kind of inflammation. And most common inflammation would be what we call the fungus, but it could be one of the other imbalance in the bacteria. There are groups of different bacteria and fungus in the vagina for every woman, and they live in harmony and does not cause any trouble to the woman. But for many different reasons, sometimes this balance between the bacteria and fungus is lost suddenly for that particular few days. Then one group may actually become more active, such as the fungus become more active. And typically the fungus activity will produce a white or creamy discharge associated with itch, which can be very intense itch. So those are easily treated by your family doctor with what we call an antifungal vaginal pessary. Yeah, you probably should not just put up with it, particularly if this has been recurring, keeps happening. There may be other underlying reasons why one is more prone to this type of activities. These are bacterial imbalances. We think that bacterial imbalances remains an important health issue.
Thank you, Prof. Tay. There's a question about if someone who is 60 years old need to test for cervical cancer, assuming she is not engaged in sexual activity anymore.
Yes, that's true. As I say, even if she has once, one time sexual intercourse in the young years, and then subsequently has been abstinence, she would still need to have a regular screening. Yeah, that's what happened to why I show you the chart that there is a gap between the awareness of the pap smear and yet a much lower uptake of the screening. Is simply because many women misunderstand that once they stop having childbirth, or once they stop having sexual relation, they are no longer at risk and they no longer need to have the pap smear. And that is the big misconception that I would like to dispel today. It's not true, okay? We said that sexual intercourse is important for HPV infection, but that need not to happen, on today's history. It could have been, a history years before. All right. So yes, every woman should who have been engaged or had engaged in sexual intercourse in the past should continue to do the screening. And that is one of the reasons in our statistics in Singapore that when we look at why the cervical cancer is not declining as fast, as much as it should be, it's because there is a group of the more sort of mature women in their 60s, 70s, and 80s who actually took that view I just shared with you and don't go for cancer screening anymore. And when they come for the abnormal bleeding or vaginal discharge, when we examined them and found a cervical cancer. So although it's totally preventable, but unfortunately it has happened.
Thank you, Prof. Tay. There's a participant who is 43 years old and she's going for her annual health screening, which include pap smear test. So she's wondering, should she take a HPV or pap smear?
Yes, I think that's the current recommendation, not just in Singapore, but in the rest of the world as well, for two reasons. One is HPV is more predictive, meaning that if you are tested HPV negative, you can rest for sure that you would not have a problem within next 5 years or even 10 years. You are safe. Equally, if one go for pap smear and the pap smear say negative, meaning that the pap smear is normal, we don't have that confidence. We don't have that 99% confidence. We only have 50% confidence. So that's why if you do the pap smear as a screening tool, you need to do it more frequently. And if you do the HPV test, you do it every 5 years. And although HPV test per test is more costly, but because you do it less often, you would end up more cost effective. So if, say, for example, in Singapore context, Singapore government is subsidizing the cervical screening, they would say they will save more money if you go for HPV screening compared to cervical pap smear. That's why from 3 years ago, we have adopted across the country, all the polyclinics, they will only do HPV screening. But for many other health screening done by private practices, their focus is slightly different. They don't look at the long-term cost, they look at short-term cost. Today, you come for the screening, we charge you this fixed sum of money. Therefore, I have to work within this sum of money. The pap smear for today is cheaper than HPV test today. So they would only offer pap smear test. So if you have a choice, you should do HPV test, but you also should make sure that you don't keep doing the HPV test. It's every 5 years. So you don't do it after 1 or 2 years. Otherwise, indeed, you would escalate the cost of HPV testing. So I would say, yes, for those who go for the general medical screening, they should look at who is paying that money, who is doing the test, and how are they going to manage it. That's why I said earlier, HPV is effective. You have to do it decisively, and you have to plan for it so that it will be most cost effective.
Thank you, Prof. Tay. I have another question for you is, the national screening recommends pap smear screening every 3 years and also at subsidized rates, but HPV testing is not recommended. Will the pap smear be good enough, or we should do both?
Yeah, as I said earlier, the national screening program actually recommend HPV and not the pap smear. The pap smear is recommended only for women between 25 and 29, only that age group, 25 to 29. Once a woman has passed, 29, 30 and above, it will be only HPV. You go to polyclinic, you only get HPV. But if you are below 30 years old, between 25 and 29, you will get a pap smear, yes.
Thanks, Prof. Another question is CA125 effective in screening?
Well, good question. It's called $1 million questions. My colleague in UK over the last 15 years used the grant from the government of almost 50,000 pounds. Well, actually not 50,000, 50 million pounds to answer this question. Would the CA125 screening for women good for cervical for the ovarian cancer screening? And after 15 years, the short answer is no. All the $50 million went down to the drain. Don't do it. So that's why I tell you and show you on my chart, for ovarian cancer, there is no effective screening. In fact, we are totally against doing CA125 blood test. It has caused a lot more confusion to many women instead of diagnosing early ovarian cancer. CA125 is very useful as part of tests the doctor do when a woman has, say, an ovarian cyst. If a woman has an ovarian cyst and I want to know whether this ovarian cyst has a chance of being a cancer, and if I do the CA125 test and the test is positive, then I would be more worried. I would say, yeah, you shouldn't sit on this cyst. You should have the cyst removed. On the other hand, if the test is negative, then of course the risk of the cancer become lower, but it's never to say no cancer. So at the end of the day, it's your doctor who is going to interpret all the test results together, not just one single test of CA125, but CA125, ultrasound scan of your ovary, your clinical symptoms, like abdominal pain or bloating, and what the doctors find during the examination on you. So it's a combination of this information. The best diagnosis that makes the best decision comes only if you have gathered all the information and analyzed all this information and come to a good conclusion. There isn't one single test that will do the job. So you should actually consult the doctor and work with the doctor, but not just blanketly do a CA125. Just like I would say, don't blanketly do a gene test to see if you have a gene variant that increases your risk of cancer. You would never get the straight answers that you want to have.
Thank you, Prof. Tay. The next question, if the womb was removed due to womb tumor, is it still possible to get cervical cancer?
No. If there is, say, for example, a tumor in the uterus and the uterus is removed, typically we will remove the cervix at the same time. As you saw in the chart, cervix is a small little part of the uterus that connect the uterus to the vagina. So that is actually taken out together with the rest of the uterus. That's why we call the operation a total hysterectomy, meaning that we leave no cervix behind. But I must say, in the recent years in Singapore, there is an increasing number of women who have a, unfortunately, wrong idea that cervix is so important for them that they need to keep the cervix. So if, say, for example, they have menstrual problems due to the fibroids or some other things and they need a surgery, they will request that the doctor only take out the part of the uterus that causes the heavy menstruation or where the fibroid is and leave the cervix behind, right? So this group of women, of course, the doctor, after discussing with you, would do exactly what you want. You want to keep the cervix, you keep the cervix. But she is no longer menstruating because the menstrual part of the organ has been removed. So she will still need to go on for regular screening. In fact, I would say the screening need to be even more vigilant, because if unfortunately cervical cancer happens, one of the treatment for cervical cancer, effective treatment, is actually what we call radiotherapy. And in radiotherapy, we do prefer to have the uterus for us to put the radiation material. So if this woman has the part of the uterus removed already, and the remaining cervix some years later happen to have a cancer, then she would have some compromise in the treatment for the cervical cancer. So in order not to get into that problem, she should actually pay a very, very careful attention for screening on the cervical cancer to make sure that it doesn't happen at all.
Thank you, Prof. Tay. If a person has taken HPV jabs at age 16, does she need to repeat in future?
No, so far, the vaccination, if it's completed according to the schedule, 16 years old should have 3 jabs done, say, over the 6 months. And if she completed in that way, there's no need for further vaccination. What she would do is she would go on for HPV screening like the rest of the women population, except that she would be a lot more assured that it is more likely that her screening will be negative. But she should never stop screening, because the vaccination does not stop all HPV. It does not, because there are 14 different types of HPV that can infect the cervix and are associated with cancer. And HPV vaccines only stop some of these 14 types. It doesn't stop all the types. So the HPV vaccination would reduce cervical cancer risk by something like 90%, as I told you, but it would not be more than that. So the screening remains important rather than repeating the vaccination at later age.
Thank you, Prof. Our next question is, what is involved in genetic test? Is it through blood test?
Yeah, good question. I didn't go into that detail. It is indeed a blood test, because if a person has inherited one gene, this inherited gene is present in all the cells, in the whole body cells. So the easiest way to get cell test is either in the blood, or sometimes just from the buccal. They just put a stick, to the mouth and scrape, the inner surface of the mouth, and they would obtain good cells. But I think blood is easier and also allows more cells to be obtained, so that the test can be a lot more reliable. So typically, it's a blood test.
Thank you, Prof. One participant is concerned about, she's asking about, does frequent UTI infection increase one's chance of getting cancer?
Fortunately, no. There are many reasons why some women are more prone to urinary tract infection, which is very distressing, I understand, but it has absolutely not related to cancer risk to the vagina, to the cervix, or to the rest of the reproductive system.
Thank you, Prof. We have time for one last question. So does a 15-year-old girl need to have a HPV vaccination even if there is no known or family history of cancer?
Yes. The cervical cancer is related only to HPV infection and nothing else. So anyone has a chance of being infected. So as I said earlier, because of the peak incidence of the HPV infection is going to be early 20s. And so it's good to have it vaccinated as young as possible, for 2 reasons. One is that the vaccine works much better in the youngs because their immune system is very young and very strong. That's why in women, 15 in girls 15 years and younger, they only need 2 injections. Whereas in the older girls, more than 15 years old, 16 years and above, they need to have 3 injections to achieve the same kind of protection. So in terms of cost effectiveness, it's much better for her to do it as young as possible. Although, yeah, no one is saying that at the, say, for example, 14 or 15 years old, having the injection, she's going to have she's going to engage in sexual intercourse and cause HPV infection. No. It's purely because early injection induce better immune response. Now that you are all very familiar with immune response with the COVID-19 vaccine. So it's exactly the same principle actually in the HPV vaccine. You need to have a strong immune system to get a good response to the vaccines. So younger girls would have a better response. So I would do it as early as possible.
Okay, thank you, Prof. Tay, and
Thank
thank
you.
you everyone for your active participation. Some of the questions asked are mainly personal medical conditions. You may wish to seek advice from your treating doctors. Please feel free to join us or share with your family and friends about the Chinese webinar session this afternoon from 1 p.m. to 2:30 p.m. You can take a screenshot of the QR code and register this after this webinar. Please help us to improve by completing the feedback form. The link will appear when you leave the webinar. You have come to the end of the webinar, and we would like to thank our valued speaker for the day, Professor Tayson, and especially everyone here for spending your Saturday morning with us. We look forward to your support and participation in our future events. Thank you and have a great weekend. Take care and stay safe.
Thank you. Thank you, everyone.
Thank you, everyone.